Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube. A reminder to maintain audio quality. Please remain muted until it's time to ask your question. If you are on the phone and are able to do so, please use *6 to mute and unmute. Joining us for today's media briefing are Governor Tony Evers and DHS Secretary-designee Andrea Palm. Also available to answer questions are Dr. Ryan Westergaard, the Chief Medical Officer in the DHS Bureau of Communicable Diseases, and Ryan Nilsestone, the Chief Legal Counsel in the Office of the Governor. We'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon, everyone, and thanks for joining us today. Last week, we entered a new phase of our pandemic response with the distribution of Pfizer COVID-19 vaccine across our state and country, a moment I know many of us had been anxiously awaiting. And this week, we announced the Moderna vaccine will be distributed across Wisconsin as well. We're expecting 16,000 doses and planning to receive a total of 101,000 doses in the next 2 weeks. And unlike the Pfizer vaccine, the Moderna vaccine can be stored in normal freezers, which allows the vaccine to be shipped directly to vaccinating entities across the state. This is really good news, and while we don't have control over how much vaccine the federal government sends our way, I can promise you that we're doing everything we can to ensure Wisconsin receives the resources we so desperately need, especially as Wisconsin faces significant challenges in mitigation that other states do not have. And we are working to ensure that our distribution plan is effective and efficient and equitable. But folks, right now, the vaccine is only another tool in our toolbox. It'll be a while before we have community-wide immunity, so we have to continue using every resource available to us. Last week, we announced Google and Apple are launching the Wisconsin WI Exposure Notification app. This app is another resource available to us and will help notify Wisconsinites faster if they have come into contact with somebody who has tested positive for COVID-19. The app uses Bluetooth technology to anonymously share Bluetooth signals with other nearby smartphones using the app. So when an individual tests positive, they can choose to anonymously notify their contacts that they have tested positive. That's important because it gives others the information they need to be proactive to protect their close contacts and loved ones by isolating and getting tested themselves. The more people who use the app, the more effective it will be. So keep an eye out for a notification in the coming days to download or enable the app on your device. And we announced today that testing will be even easier with the addition of the Vault Medical Services at-home COVID-19 testing kits. These kits will be available to Wisconsinites at no cost, and anyone can get one by ordering their test kit online. The kit includes detailed instructions on how to collect saliva for testing and where to send the kit for processing to get your results. Just like a nasal swab test, the saliva test will tell you if you have active COVID-19 infection. In our state, everyone who needs a test should get a test. That is why we've worked hard to expand our lab capacity, support our healthcare workers, and to stand up community testing sites in collaboration with local and tribal public health folks and the Wisconsin National Guard. But even all this work isn't enough when we know that getting to a healthcare provider or a community testing site is easier for some folks than others. That's why we're excited to offer this additional testing option that will help us box in the virus. From the vaccine we are working to get it distributed across the state, to the WI Exposure Notification app and the Vault Medical Services at-home COVID-19 testing kits, these are great new tools Wisconsinites can use to fight this virus. Additionally, we are announcing today that we are able to provide some assisted living facilities with expanded testing access. While we are able to offer support to assisted living facilities in the case of an outbreak, this new program will build on existing partnerships to allow for more routine testing. But the bottom line is that these tools don't work on their own. We must continue the strategies we know can and will help stop the spread of our state in our state, especially with the holidays upon us, by staying home, wearing a mask, and practicing physical distancing. I don't have to tell you all that this year has been tough. And I know all of us, Kathy and I included, would rather spend this valuable time around holidays with our friends, families, and loved ones. But COVID-19 has not gone away, not even close. And while we can see the light at the end of the pandemic tunnel, we are not in the clear yet. So let's enjoy the holidays safely by protecting everyone's health and well-being. Just as I did last month, I'm encouraging Wisconsinites to celebrate the holidays virtually and within their own households. Don't host parties or gatherings at your home or anywhere else with people you don't live with. One positive test at the dinner table can turn into 10, so please don't risk it. Celebrate small this year, and let's hope for bigger and brighter celebrations in the new year when we can all do it so safely. With that, happy holidays, Wisconsin. Stay healthy and safe. I will now hand things over to Secretary-Designee Andrea Palm for her update. Andrea, it's all yours.
Thanks, Governor. Good afternoon, and thanks for joining us today. As the Governor just said, we have some innovative new programs to talk about today. I'll start with our new at-home saliva collection, saliva collection COVID-19 test kits, so you can get a sense of how it works. Once you request the kit from the COVID-19 testing webpage at the DHS site, it will be shipped directly to your home. The kit will include detailed instructions on next steps, which involves scheduling a video call with a Vault Medical Services healthcare provider during which the actual saliva collection occurs. Once you've done that, you seal it back up and send it back to the lab with the packaging that they have provided by placing it in a UPS drop box. You'll need to do it on the same day as your collection video call. The kit goes to the lab for processing, and you'll receive your test results by email. This is a PCR test, so even though the mechanism of the test is different from the nasal swab you might get at a clinic or one of our community testing sites, it has the same level of accuracy. Testing has been and continues to be an integral tool in our work to box in the virus, and we are excited to continue to diversify our options and expand access to testing in Wisconsin. This is more important than ever. In recent weeks, we've seen a decrease in the number of people seeking COVID-19 tests, so let me remind you, if you need a test, you can get a test. If you have symptoms or have been exposed to COVID-19, please call your healthcare provider or visit dhs.wisconsin.gov to find a community testing site. And for more information on these sites and our new at-home saliva collection kits. Please keep in mind that the hours for our community testing sites may be different this week and next week, so please check before you go. In addition to our testing announcement, and as the Governor mentioned, we're also launching the Wisconsin Exposure Notification app tomorrow. To build on what he said, I want to encourage everyone to activate it. In the coming days, you will receive notifications prompting you to do just that. So all you have to do is follow the steps to either download the app or activate it in your settings, depending on the kind of smartphone you have. I'm not the most tech savvy of people, so I will explain it like this. The app uses Bluetooth technology on your phone to detect when other phones are near it. If you receive a positive test for COVID-19 and you use the app, you'll receive a text message which will ask you to activate the notification system to let other app users know that they have been exposed. This notification is only sent to other app users who have been in close proximity to you for about 15 minutes or more, and it does not share any identifying information. In fact, the app does not track or store location information at all. The app works best when as many people as possible use it, so thank you for following these notifications that you're going to receive in the coming days. So now I'd like to give you an update on our numbers for today. We're adding 2,403 new positive cases today, which brings our total confirmed cases in the state of Wisconsin to 461,015. Our 7-day average of positive cases is 2,660. And today we are reporting 120 more Wisconsinites have died from COVID-19, which brings our total deaths to 4,545. As always, our thoughts are with the families and friends who have lost loved ones, especially as you feel this grief during the holiday season. To say this has been a challenging year is a significant understatement. And as we get closer to the start of 2021 and continue the rollout of the vaccine to our healthcare workers and soon to the residents and staff of our skilled nursing facilities, it remains critical that we continue our efforts to stop the spread of COVID-19. Please stay home and limit your interactions to the people you live with. Wear a mask, physically distance, and wash your hands to protect your health and the health and safety of those you care about. Please have a healthy, happy, and safe holiday season. Thank you.
Thank you, and we'll now take your questions. A reminder to maintain audio quality. Please keep phones on mute until it is time to ask your question. And we'll begin this afternoon with Todd Richmond from the Associated Press. Todd?
Hi there. I was wondering how much is the Vault saliva test contract? What's it costing the state?
Yeah, thanks, Todd. So some of that is, it's dependent on how many people order the test. So Vault has the capability to bill health insurance, and if you don't have health insurance, then that bill will come to the state, and we will pay for that so that this testing remains at no cost to individuals here in the state of Wisconsin. But we will see over the coming weeks how many folks, what the demand is for this new option, and we'll be able to provide better information once we see how many folks here in Wisconsin take advantage of this opportunity.
Thank you, Todd. Now to Danny Maxwell from WKOW-TV in Madison. Danny?
Hi, wondering how long the results will take to get back on the at-home test kit, and if any labs in Wisconsin are being being utilized to get those test results.
So Vault is a lab with a facility in Minnesota, and we expect turnaround times to be comparable to what we have with our other contracts for these PCR tests that are also headed to labs for processing, and then our assisted living facility expansion of testing is with Fulgent, which is a lab we also currently have a contract with, and are expanding that contract to access their at-home testing supplies as well.
Thank you, Danny. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thanks for holding this. Just was wondering, Governor, the federal COVID-19 relief legislation doesn't provide aid to state and local governments. What happens to the activities like the storage facility, COVID-19 testing after the start? Is that a hard stop date, or how long will they last? Thank you.
I didn't hear the last part of the question.
Sean, you were breaking up a little bit. Could you please repeat your question?
Sorry. Just was wondering for the CARES Act funded activities in the state related to the storage facility, COVID-19 testing, given that there's no aid coming from the federal government in the legislation that was passed last night, was wondering how long those would last, or if there's funding to continue them beyond the start of the year.
Certainly, the CARES Act, as I understand it, does have money for us to do contact tracing and testing, and we will, it certainly isn't enough to get us through the next calendar year by any stretch. So we know that it's not adequate. We know that we can use that money for that purpose. So the plan is to convince Congress to come back in session with a new president and really finish the job in a good way. This, just what every one of the legislators who supported it said, this is just the beginning. So of course there will be lots of angst and gnashing of teeth in Washington, D.C., but I believe that the federal government will need to take another look at this and really do the right job this time instead of just a piecemeal job.
Thank you, Sean. Now to Ben Krumholtz from Fox 11 in Green Bay. Ben.
Hi, thank you for the opportunity. Governor, what are the most concerning developments going to be for residents if a relief package is not passed in the state by the end of the year?
Well, I think there's a whole number of issues, including funding that we are hoping to get. But I would say the one that concerns me the most is the inability to convince the Republicans that a 1 week to do away with the 1 week waiting period for unemployment insurance. People wait too long the way it is, and we believe that that waiting period should be waived for the same period for this period of time.
Thanks, Ben. Now to Brett Lemoyne from Fox 6 in Milwaukee. Brett?
Hi, good afternoon. Is the state screening for this new strain of COVID-19 that's hitting the United Kingdom right now? And if so, what can you tell us about any mutations that have been identified since then?
Yeah, Dr. Westergaard, can I kick that to you?
Yeah, absolutely. Yeah, thanks for the question. So as many people I'm sure have heard, there is a strain in England and other countries in Europe that has a specific genetic signature. I mean, has a certain profile of a number of gene mutations which make it unique that seems to be associated with a cluster that's spreading faster. There is some concern that the genetic differences in the strain of the virus might make it riskier or make it more transmissible, but that hasn't been definitively proven yet. There's a lot of interest and a lot of study underway to see, is this a new strain of the virus that might spread more easily from person to person. So in order to test for that specific strain, we need to do what's called whole genome sequencing, which takes a sample of the virus from a test and essentially reads the genetic code, the RNA of the virus. That was how that they were able to identify that this is a unique strain. We do this in Wisconsin on a routine basis, but on a relatively small proportion of the tests that get performed. It's been several thousand that we've done this full whole genome sequencing. So far, we have not seen any of the patterns that are identical to the strain that we're discussing in the UK, but we're continuing to look for it. That being said, it doesn't mean that it's not here. It's relatively, like I said, a small number of viruses that we test for that get the full genome sequencing. So it's another reminder that we need to be really aggressive and really mindful of preventing the transmission of disease everywhere. The other thing I think it's important to know is that mutations among viruses are very, very common. It's not unusual. In fact, it's expected that as time goes on in an epidemic, the genetic sequence of the virus will change. One thing that we've known about this COVID-19 virus, SARS-CoV-2, is that it doesn't seem to mutate as rapidly as some other viruses, but it is definitely expected to see over time through random mutations some changes in the viral makeup. So here in Wisconsin, we're looking for it. We're sequencing viruses that meet certain criteria in certain areas, but so far we've not seen any.
Thank you, Brett. Now to David Wahlberg from the Wisconsin State Journal. David?
Yes, thank you. I'll ask you a question that a reader asked me after I posted a story about the new free at-home testing today. The reader said, if it's free, why do I have to provide my credit card number?
So David, you should not have to provide your credit card number. We worked to make sure that that was not going to be an issue, but we should take that back and make sure that folks are checking on that. And we'll loop back with you so that you can be back in touch with your reader. But there should be no cost to Wisconsinites, and we would encourage people not to enter their credit card numbers, but to exit and go back into the application and try again. But we'll get back to you, David, more specifically for your reader.
Thank you, David. Now to Cammie Rapson from WBAY TV in Green Bay. Cammie?
Good afternoon. I have a question for the governor. Governor, with many local testing sites on hiatus over the holidays, even with the addition of this home testing, it could have an impact on the percentages, either positive or negative, that many school districts follow to indicate community spread. Is it time for the state to step in for those districts that remain fully virtual and provide some specific guidance to get children back to at least a hybrid model?
Well, I think those discussions are already happening across the state. I'm not sure an intervention by the state is going to change the direction of those dialogues, whether it's in the Milwaukee area, the Madison area, or any of the other areas that may be virtual. So I think those discussions are already happening, and they are certainly happening with the consultation of the local public health folks, and even without maybe less testings and basing things on positivity, they'll be able to get that information directly from the public health officers, or at least their interpretation of what's a good avenue for them.
Thanks, Cammie. Now to Stephanie Hoff from WIS Politics. Stephanie?
Hi. So earlier you mentioned that the state will pay for these on, depending on how many people are ordering the test. What do they cost per kit?
Stephanie, I honestly don't know the details of the specific contracts, so we'll have to get back to you.
Thanks, Stephanie. Now to Terry Kovarik from Door County Daily News. Terry?
Yes, good afternoon. I will throw this out to whoever can answer it best, and maybe we're getting a bit ahead of ourselves. Tomorrow, they'll be rolling out the launch of an app, the Wisconsin Exposure Network, which will allow people with their smartphones, if they've been diagnosed with COVID-19, on tracing back, contact tracing through that technology. How is this developed here? And basically, how does this help local communities, especially the county health departments that are in the process of trying to do the contact tracing? How does it make the job easier for them?
Yeah, it's a great question. And I think, right, as with all of the pieces of this response, we have tried to expand our tools, diversify our tools, bring new tools to the fight, to spread the work, to engage the people of Wisconsin in helping to fight COVID-19. And so when you get that push notification, again, we encourage folks to activate and opt in into the system. Once you get tested, if you receive a positive result, you will get a text message with a code, and it will ask you if you want to use that code to notify folks that your Bluetooth knows are close contacts. We encourage you to answer that question yes and use the code, and then that will ping those folks with an anonymous notification that they were in close contact with someone who has tested positive. It doesn't certainly replace contact tracing or the work of local public health as it relates to disease investigations and being in touch with folks through the work that they are currently doing, but it does allow us all to get a jump on what we do next, right? How quickly we can act to isolate and quarantine, to take those next steps to get ourselves tested if we receive that notification that we were in close contact with someone. But we just want to make sure here in Wisconsin that we are using as many tools at our disposal as we can, and give folks more options to be part of the solution here, part of how we all work together to get to the other side of this outbreak.
Terry, thank you. Now to Eric Gunn from Wisconsin Examiner. Eric?
Hi, thank you for taking my question. This is also about the school situation. There still is a widely circulated assumption that in-person schooling is quite safe and it's easy to accomplish where COVID-19 is concerned. One sees this a lot in various circles. But I want to know, is the scientific evidence so strongly in that direction? And if it isn't, what does the science show and what is required to ensure safer in-person classes? And I guess I direct that to any of you who would wish to respond.
Well, I'll just start out, and if I miss a few points, I know my health colleagues will follow up, but the evidence does tend to show, I believe, from what I've heard experts say, is that young people don't transmit the disease at the same rate that other folks do. And we have good experience around that issue statewide. And so that's helpful. There are places that have had in-school, in-person education for almost the entire time in the state of Wisconsin and across the country. And there are many cases in which there are many instances where there have been few or no cases. So in the cases, and many times the cases that have occurred because of something outside of the realm. And you know, the things that can keep people safe in school are the same that keep people safe outside of school. And that's wearing a mask, trying to keep as socially distanced as possible, lots of good hygiene, lots of washing your hands. And we have seen success. Obviously, there are times when schools need to take a break from in-person education, and they need to clean the school again, disinfect the school. But many times the reason that schools have closed for a short period of time is because there's not enough teachers, and folks because once there has been a disease found in the school or somebody's been infected, you quarantine all the people that have been exposed to that person, and that includes the teachers. And many times school districts are just flat out running out of teachers. That said, it has happened in school or in person has happened since this pandemic has started, all across the country in various places and all across Wisconsin in various places, and has been found to be successful, but the road is many times bumpy.
Thank you, Eric. Now to Terry Sater from WISN TV in Milwaukee. Terry. WISN. Okay, we'll move on to Denise Lockwood from Racine County I. Denise. Once again, Denise Lockwood. Okay, moving on again to Jeff Dada from Spectrum News. Jeff.
Hi, thank you for taking my call. I'm just, my question's about the infusion therapy at the ACF. I'm just wondering, have you guys taken any patients there yet? And is this something that you expect to be used heavily? Have there been interest from very many healthcare providers in sending patients your way soon?
Mm-hmm. Yeah, thanks. As of this morning, we do not have any patients in the infusion clinic, but I would ask Dr. Westergaard if you could talk a little bit about the other parts of Jeff's question.
Well, I think it's we have two of the monoclonal antibodies, or the synthetic antibody treatments that are available for use, and they serve a role in the treatment of people who are at risk for hospitalization and severe disease, but are not yet sick enough to require hospitalization. So it's a relatively narrow window in which these treatments can do a lot of good. So our position is that we want to make sure that the healthcare providers and patients are aware that they exist. understand what they can be useful for, which is hopefully to prevent mild disease from turning into severe disease, and also that it needs to be used promptly after diagnosis to have the best effect. So I think that how much the drug gets used depends on sort of how we can increase awareness and develop systems to deliver it efficiently. But it's definitely a useful tool that we're promoting, and it's received FDA authorization as an appropriate treatment in those settings.
Thanks, Jeff. Now to Mary Jo Ola from TMJ4 in Milwaukee. Mary Jo? And Mary Jo Ola? Okay, moving on then to Jonathan Nizer from NBC 26 in Green Bay. Jonathan.
Yes, thanks for the opportunity. I know we're awaiting the Supreme Court ruling, but given the current case numbers and trends, Secretary Palm, if you could put capacity limits back in place, would you?
I'll be glad to answer that. We would, yes, if we had the opportunity, this is Governor Evers, if we had the opportunity to use mitigation, especially around mass gatherings of people, whether it's inside or other situations, certainly we would. I mean, just about every other state in the nation has done that, and has done that with success. But clearly, our mitigation strategies are limited, and we will continue to do the best we can with the tools that we have.
Thanks, Jonathan. Now to Amy Reed from News 3 Now in Madison. Amy.
Good afternoon.
Excuse me, Amy. I just wanted to finish up the last question. I also, I understand that the case numbers apparently are going down, but I can remember back when we had 60 a day, and we thought that was a hell of a lot. And so I think it's obviously the right direction, but we frankly still have a long way to go. So my comments about mitigation still hold true. We would use whatever tools we can to make sure that people stay safe.
Thank you, Governor. Now to Amy Reed from News 3 Now. Amy?
Good afternoon. Governor Evers, at least one Republican said that the bill that you put forward yesterday was not actually a compromise, and Boss's staff told me that by doing this, you essentially walked away from the table. Are there parts of the compromise legislation you're still willing to move more on, or how else would you respond to these critiques?
Well, critiques are great, but here's the deal. It is a compromise because there are probably anywhere from 20 to 25, I can't remember the number, frankly, that all three participants agree to. There are several that we have not agreed to. But that doesn't mean, people have been waiting for 200 plus days, 230 or more days for something to happen. We can make something happen tomorrow if people would be willing to do this. My point with the letter is to point that out, that we have significant common interests, and if we're going to let the perfect stand in the way of the good, or any type of similar analyses, we may end up with nothing. So that's my point. Will we continue to talk? Yes, we can, but I truly believe that many of the ones that are yet resolved are resolvable. So let's have something for the people of Wisconsin to say, indeed, the executive branch and the legislative branch can actually accomplish something.
Thank you, Amy. Now to Martin Raccasoli from WORT Radio in Madison. Martin.
Yeah, thank you for taking my question. So, I guess this is for Governor Evers. So the federal bill, I do believe that you mentioned that it was a a first provision that they would be revisiting it. That is what they've said. That's what Chair Brown said. That's what a few others have said. But it does allocate money for use in the in states. Do you know, relatively speaking, how much of that Wisconsin is going to get? And how does the money allocated to states, for Wisconsin specifically, affect the state bill that's currently being negotiated?
Well, first, yeah, and you don't take this to the bank, but if things are allocated according to the number of people that live in the states, the census, Wisconsin usually gets anywhere from 1.7 to 2%, depending on the program, and whether this is similar or not, I'm not sure, but it gives you an idea of what percentage we would get. That whatever that number comes out to be, I can guarantee you that it is not enough to continue contact tracing, testing, and other items to get us through this pandemic. That's why the legislators that you saw talking about this or read about it indicated that this is the first step. This is all they could get accomplished at this time. Certainly the incoming president and others feel that it's important to continue this type of investment, and we're hoping they do, because it will not cover testing, contact tracing, all the public health things that we're doing right now for the entire year, not even close.
Thank you, Martin. And we have some time, so we can go back to some folks that we called on that weren't available immediately, and we'll begin with Terry Sater from WISN TV in Milwaukee. Terry?
Yes, I'm wondering, will the current vaccines used in Wisconsin protect against the new COVID-19 variant or other strains?
Dr. Westergaard?
Sure. Ryan Westergaard here. There's no evidence to suggest that it will not. There have been other mutations in the spike protein gene for the virus that seems to make it susceptible to the same therapeutics in the same vaccine. The discussion around this has been, it seems very unlikely that mutations over this shorter period of time would change the virus sufficient to escape vaccine. But of course, there's still a lot that's unknown. But right now, there's not much concern that would be a problem. The vaccine should be effective against all known variants of the SARS-CoV-2 virus.
Thank you, Terry. Now, Denise Lockwood from Racine County I. Denise?
Hi, thanks. My question is about the economic impact of COVID-19. Do you guys have like a tally of how much this has actually cost the states?
You're talking about state government or the entire economy?
The entire economy, and both, actually.
I'm not sure I can answer both specifically. Certainly, we've spent, we had $2 billion of CARES money that has been allocated, and almost all of it expended already. So that gives you one small benchmark, but certainly if you count unemployment issues and people suffering as a result of this pandemic, I do not have that information. I'm sure there's some think tank that has done it, but frankly, how do you put a monetary value on some small business person going out of business because there's not enough economic activity that people want to spend money on going to a restaurant per se, and the impact that has on that family that is depending on that money from that closure. So it's astronomical. There's no question about it. When you're talking about almost $1 trillion in aid coming from the federal government, and that isn't for a nation that just isn't close to being what needs to happen in order to make our economy strong and to get people through this. It's a big number, and I don't have it, but I'm hoping that what I've said gives you an idea of the magnitude of it.
Thank you, Denise. And one more time for Mary Jo Ola from TMJ4 in Milwaukee. Mary Jo.
Hi, good afternoon. Just going back to the at-home test kits, and I'm sorry this is a little redundant, but is there any concern as to if everyone in Wisconsin starts doing these at-home test kits, if they will overwhelm the labs and delay the results? In addition to that, can people start to request tests today? Thank you.
Yeah, you certainly can start to request tests today. We are certainly in close touch with the lab about capacity. We do not have concerns at this point about them not being able to handle what the requests that might be coming from Wisconsin on a daily basis. Obviously, turnaround time is a critical part of our testing program across the board, and we monitor those issues with all of our labs and all of our contracts. So it's certainly something we will keep a close eye on, but based on our conversations with Vault, we do not anticipate having capacity issues here in Wisconsin.
Thank you, Mary Jo. And that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a good afternoon.